Well, good morning, everybody. I just let you know before we get started that we are recording this session. So if you don't want to be recorded, please turn your video off and also put yourself on mute. And if you'd like to remain completely anonymous, you can also change your name on the participant to just to say participant. It's a great pleasure today to welcome you to our second listening and sharing session as part of our 24-hour listening and sharing session that we're doing as part of the IAACD, so the International Alliance of Academies of Childhood Disability. And this session is being hosted by our colleagues in Singapore, and a big thank you to Laura for organising this session at very short notice. And it's fabulous to see so many people who have joined us, not only from Singapore, but from all over the world. So I hope you enjoy today's session. As I said, it will be recorded and the session will go up on our website, which you can see down the bottom of the screen over the next few weeks for you to review later. And you're also welcome to join any other sessions that we have over the next 24 hours. So without any further introduction, I'll hand you over to Laura. Thanks, Laura.
Thank you, Alicia. Thank you, Alicia.
Thank you.
Welcome to the Singapore edition of Apart Yet Together. My name is Laura, and I will be the chair for our session today. It takes a village to help the village. I'm a senior physiotherapist from the Department of Pediatrics at the Khoo Teck Puat National University Children's Medical Institute at the National University Hospital in Singapore. I would like to thank the IAACD for giving us this opportunity to present our experiences in response to the COVID-19 pandemic. I would also like to extend a warm welcome to all attendees, especially those joining us from around the world. It takes a village to raise a child. This is even more so if the child has a disability. The disruption caused by COVID-19 has been unparalleled as families lost their support framework overnight. The multidisciplinary team caring for children with disability have had to be responsive to the national COVID-19 protocols that were implemented swiftly and were highly fluid. The information in this slide is from the WHO, showing our infection and mortality rates in Singapore. In Singapore, the Disease Outbreak Response System condition, known as DOSCON, is a public alert system that was developed following experiences from past pandemics like SARS, H1N1, and MERS. DOSCON takes into account the current disease situation overseas, how transmittable the disease is, how likely it is to arrive in Singapore, and what impact it may have on the Singapore community. Singapore is currently in the DOSCON orange phase. This slide shows the COVID-19 timeline in Singapore. Of significance was that on the 7th of April, a circuit breaker was implemented. The circuit breaker was to preempt the trend of increasing local transmission of COVID-19 by reducing the significant movements and interactions in public and private. Schools were closed, in-house dining was closed, and people started to work from home. It was initially planned to be in place for 4 weeks, that being 2 incubation cycles. But this was subsequently extended to the 1st of June, a total of 8 weeks. There was significant impact on face-to-face consultations at the hospital during this period. On 1st of June, the circuit breaker entered its phase 1 of gradual reopening, and on the 19th of June, Singapore went into phase 2, where further control measures were eased. Here, you will see a comprehensive infographic of the ICF framework and F words from the Can Child and the referenced authors. As a result of the circuit breaker, the greatest disruption for children with disabilities are in the domains of fitness, friends, and family, and fun. COVID-19 was also the catalyst to expedite telehealth provision, where telehealth aims to monitor, follow up, and provide care for our patients and their families in a remote manner, either through phone calls, emails, and virtual consults, or a combination of the above. The following speakers will go into more detail about this. Telehealth was to ensure that patients and families were not isolated and care provision continued. Our speakers, who are part of the multidisciplinary team, will highlight how measures were implemented and adapted to cope with these disruptions. Dr. Tan Mei Yi is the Associate Consultant at the Child Development Unit with an interest in neurodevelopmental outcomes of children with neurological conditions and a special interest in epilepsy and cerebral palsy. Kimberly Quek is the Senior Staff Nurse who supports the neurology team as the epilepsy nurse with a pivotal role supporting parents with their epilepsy management strategies. Charlotte Lin is the principal dietitian with an interest in pediatric nutrition, particularly in children with metabolic disease and feeding difficulties. Jocelyn Tan is a senior speech therapist who is also part of the feeding and nutrition clinic that assesses the safety and functional feeding skills of our children with complex medical needs. Melody Poor is a senior physiotherapist who strongly advocates the translation of research into practice for children with neurological and complex genetic and neuromuscular conditions. Tan Jia Xuan is a senior occupational therapist with a special interest in child and adolescent mental health, early intervention for premature babies, chronic disease self-management, and transitional care. I will now hand you over to the speakers.
Hi, good afternoon. My name is Kimberly. I'm the kids epilepsy nurse. I work with a team of neurologists and alongside with our allied health professionals. Today, I'm here to share with you my experience with the patients, both local and overseas patients during the COVID pandemic. So here are some of the restrictions that we faced during COVID-19. We had to limit the numbers of patients coming to clinic. Our overseas patients were not allowed to enter to Singapore, and we were concerned of medication supply shortage and shipment delay. Here are some of the frequent concerns from the parents. They are concerned if it's safe to come to the hospital during this period. They were concerned of their child's progressions and treatment delay. However, for safety reasons, they wanted to postpone their appointment. And they were also asking for more medications to tide them through to their next appointment. So additional concerns from families that are living overseas. So they are not able to come to Singapore for consultations and treatment. So how should they do to get the consultation with the doctor? And they would also wanted to reschedule their appointments to end of the year in hope that they could come into Singapore. For this, we were not able to advise them as there were no endpoint as to when they could come into Singapore again. So we asked them to hold on to their appointments, and once the borders are open, we will reschedule it for them. And they were also running into medications issues as their supplies are all running low. So what should they do to get more medications? So here are the challenges that I faced during the COVID period. How can I ensure that my patients are reviewed timely and receive the treatments they require? Patients and parents may not know how to use Zoom for teleconsultations. So what can we do to help them? And how can I help my patients to get their medication supplied to them? So to overcome these challenges, we offered telehealth to our patients, both local and foreign patients. We follow up with them first via email or phone call to understand on the patient's condition. And then we'll usually send a patient the explanatory slides on how to use the Zoom prior to the real consultation so that they'll be prepared for the teleconsult. We also offer telephone consultation for those who are not able to use Zoom, but this is only applied to our local patients as our phone in the hospital are not able to call overseas. So to minimize the disruptions of patients' medication supply, these are the few things that we did. So for overseas patients, we ask them to actually go to their pharmacies to check if they have similar drugs available in their home country and or alternative drugs available that the neurologist can actually take in to see if there's a need to switch medication so that they have enough supply of medicines. Other alternatives were to get their friends or relatives who live in Singapore to actually get medicines and then to deliver it to them. Singaporeans are actually given the options of home delivery, which are free during this period of COVID. For our foreign patients who actually get their relatives or friends in Singapore to help them actually send the medicines over to them, we actually provide memos so that they do not face any issues at the customs when the medicines are being delivered to them. We had options. We did try an option to see if the delivery company could actually work directly with the hospital to get the medicine delivered to them. However, we had issues with packaging and ensuring that the medicine reached them safely. So at the end of all the teleconsultations, I will usually do a follow-up with the parents via email or phone call to ensure that all their queries and concerns have been addressed. This is the end of my slide. Now I will hand it over to the dietitian and the speech therapist. Thank you.
Hi, I'm Charlotte. I'm a dietitian working at the NUH Feeding and Nutrition Clinic.
Hi, and I'm Jocelyn. I'm one of the speech and swallowing therapists, and I work together with Charlotte running the feeding clinic at NUH.
So basically, we are a multidisciplinary team that consists of a doctor, a dietitian, a psychologist, and a speech therapist, and we work together to address children with nutrition and feeding difficulties. We are a one-stop assessment clinic that provides a comprehensive assessment of a child's feeding skills, mealtime behaviors, and during this process, we also observe parent and child interactions during feeding. So basically, we see a whole variety of different patients across various medical conditions. And this is just a quick summary of the patients that we do see often in our feeding clinic. So it may include infants with sucking and or swallowing difficulties, children who are highly selective and picky eaters, or those who have very specific food refusals or oral aversions, children with failure to thrive, or children with feeding skills deficits as well as dysphagia, and children who might be on tube feeding for their nutrition, and those who are on specialized diets. The treatment for these patients may include a combination of feeding therapy sessions, behavior modification programs, and or parent training sessions. So during the COVID-19 pandemic, which is still ongoing at this point of time, there have been many impacts on feeding and nutrition related services. These are just some examples of how the children with feeding difficulties have been affected, and we'll discuss them today. So there have been delays and disruptions in assessing of services because during the circuit breaker, many of the non-essential services had to be rescheduled. And as such, some parents also may have been fearful of the risk of contracting COVID-19 in hospital, and therefore did not bring their children to hospital for assessments and follow-ups, particularly children at risk of dysphagia. And so their appointments to get an assessment may have been delayed. Also, children with chronic failure to thrive may have also faced the same issue. Access to regular or necessary food supplies may have been disrupted also during this time. Highly selective feeders may have required specific food items. So for an example, some of our patients only ate chicken nuggets from a particular store, but due to the COVID-19 pandemic, lots of services and food outlets may have to be closed to minimize the risk of COVID-19. So such patients were not able to get their usual food, usual chicken nuggets from these stores, and therefore did not eat any protein, which might have impacted on their nutritional status. Also, some children had very specific dietary needs and therefore required certain food items that needed to be purchased from a supermarket. An example would be those who were on ketogenic diets. Their diets required cream with a very high fat content, and due to nationwide shortages during the circuit breaker, because of limited imports as well as an increased surge in home baking, because many dessert shops were closed, parents had to scramble think of alternative food sources to replace this cream, and we gave them some suggestions on how to do so as soon as possible. There might have been also disruption to regular meal schedules as well as meal time and sleeping patterns also as well. During this period, children were not able to attend school, and parents also had to work from home and juggle all aspects of child rearing as they had to make sure that their children were well fed and had their proper nap timings. As such, some of the children may have a delay in these timings, and also therefore impacted the way they consume their meals during the circuit breaker. As a result, this might have increased stress for the caregivers, because they had to have 7 straight weeks of juggling work, home-based learning, as well as the emotional needs of the children in their household without the support of the extended family during that time.
So from the service point of view, we did face multiple challenges in the way we actually deliver our services. So like what my colleagues have shared before, we did cut down on face-to-face appointments and had to make the rapid transition to Tele-Consultations. So it was a really steep learning curve for a lot of us, because, there was something very new, and all that logistics and workflow setup, needed time and effort to kind of prepare. And on top of that, we were given different information every day that required us to kind of be flexible in the way we actually handled the carrying out of the services. Even though subsequently, when face-to-face appointments were being allowed again in the hospitals, it wasn't the same as before this whole pandemic actually started, because now we needed to wear personal protection equipment during our sessions, and as therapists it was pretty challenging in the way that we actually conduct our sessions now, because it was difficult building rapport with children, especially for those that were seeing for the first time, the younger children who are generally more fretful coming into the hospital environment. So, we had to be really creative in how we wanted to build rapport and actually even spend more time building rapport with them before engaging them in therapy activities. From my side of things, as a speech therapist, I rely a lot on modeling of my mouth movements, facial expressions, trying to get the children to eat, and having to wear a mask all the time kind of limited my ability to do so, and hence I really had to rely on giving parents very clear and specific instructions, or making use of different models like toys or videos to actually demonstrate to my patients the kind of movements I wanted them to follow. Another thing about this pandemic was that due to social distancing restrictions, we are unable to conduct group workshops or group therapy sessions that we were used to be holding, and it did kind of impact on certain groups of children who actually benefited from these kind of services. We'd just like to share with you some of our experiences and how we actually adapted during this COVID-19 pandemic, and the benefits that we actually see when we actually moved our services to a teleconsultation mode. I think for us, I really see the benefits for children with complex medical needs, as they are now able to access the services from home. Previously they require a lot of planning from the parents' side in terms of coordinating transport, logistics, making sure the equipment and milk were sufficiently brought to the hospital so that the child can last the whole day. And a lot of times when the child actually came to us, they were really tired, cranky, and they were in a very unfamiliar environment. So being able to see them over teleconsultation in their home was really useful, because we are able to see them in their best conditions, and their schedules were not disrupted. They were in a familiar environment. I think another benefit was that we were able to really see what's contact going on at home. For some children who require specialized wheelchair or sitting arrangements, they are pretty bulky, and parents have shared that they were not able to bring them into the hospital setting. So, we weren't able to see what actually worked best for the child. And by actually seeing these kids on a teleconsultation platform, we were able to see what kind of equipment they actually have at home and what worked for them. I think it was also useful to kind of see the kind of foods that they were actually parents were actually offering their children at home. Another thing was that we were also able to see how parents and child actually interacted in their home environment. That was very different as compared to in the clinic setting, where the therapist was there, the child was aware that someone else was watching them, and a lot of times they do not actually demonstrate what they actually do at home. So being able to see what actually goes on at home help us get a better picture and understanding of what parents were actually going through, and then we can really support these parents in a better way. And of course, with the start of every new service, I think there was quite a number of challenges that we faced. We did realize that teleconsultations was not suitable for everyone. Like what I mentioned, children who have never seen before, it was very difficult building rapport over an online platform. Children who actually had high choking risk or had lots of swallowing difficulties, therapists were not comfortable with actually making any drastic changes in their food or diet recommendations, because there was a limitation to how much of these signs and symptoms of swallowing difficulties we can actually pick up from just from an online platform. So we weren't able to kind of make as drastic a change. We kind of were limited in what we could actually do. For certain families, the setup at home, with everyone being at home, other siblings being around, it was not a very conducive environment for therapy to actually take place in. We had to be really selective with the kind of caregivers and families that we actually offer these services to, because like what I shared about, that we actually need to really be able to pick up on signs of choking, signs of swallowing difficulties, and sometimes when the internet connection wasn't very stable or the view wasn't good, we weren't able to do a good assessment. So we require a lot of reliable reporting of symptoms from the caregivers, and also cooperation from the caregivers to be able to position the camera in the right angle so that we are able to get the best view that we can to make a good clinical judgment. I think for Charlotte herself, she did share with me that there was a limitation to doing full video consults, because the dietitians weren't able to take anthropometric measurements for the child's height and weight, so we weren't able to really track timely whether or not our interventions were effective or not for these patients. So I'm just going to share with you some of the pictures that we've taken, of our therapists actually doing a teleconsultation service over a video platform. So we were able to kind of, so this was a picture of a child that we were kind of working on their cup drinking skills and as well as their chewing skills, and the therapist is trying to model the kind of support that the parents should be providing the child, how they should be holding the oral motor tool so that the child's able to get effective practice. And now here we got a couple of views of what a therapist point of view looks like when we are actually doing a video consult service. So as you can see, what we're looking out for is the positioning of the child. We're able to see, how the parent and child actually participate together in the interactions during a meal time. For an older child, we might be able to kind of be really more interactive with the child during the feeding sessions, able to see their chewing movement, how they're actually moving their food. And this little one was actually very cooperative in letting me have a look at inside his mouth to see whether he's actually manipulating his food the right way.
Okay, so just to conclude, we do feel that teleconsultation services will continue to stay to supplement face-to-face visits, especially for children with complex medical conditions and who require more close feeding surveillance, and also particularly for those who require more specific feeding advice. I think we've seen the benefits of teleconsultation services, and we do feel that it benefits a good number of our population with the pandemic still ongoing. Also, there needs to be some more adaptations for the face-to-face sessions. Especially during feeding therapy sessions, we will encourage more parent participation and involvement in modeling and leading the session because there needs to still have some level of social distancing between the therapist and the patient, as well as the therapists having to wear their personal protection equipment. Parents will still need to lead the session and model and do a bit more modeling for the patients. There also needs to be more transitioning of the group therapy sessions and workshops to online platforms, and we will continue to do so. We will also continue to develop more electronic resources to support parents during this pandemic as well. Thank you.
Hello, I'm Melody and I'm a physiotherapist, and this is my friend Jia Xuan.
Hi, I'm Jia Xuan. I'm the occupational therapist. As you've heard from some of our colleagues, COVID-19 has certainly forced us to get creative. So Melody, what was it like for you during the circuit breaker?
So I'm a physiotherapist, right? So the patients that I see are children with neurological conditions like cerebral palsy and Duchenne muscular dystrophy. And I also work with a lot of specialized equipment like adjustment of standers and customized wheelchairs. At the start of circuit breaker, it was actually a mad scramble to reschedule the caseload, make sure that patients have sufficient whatever it is that they need. So for those who were on intensive rehab programs, that they had a home exercise program, and for those who were post-procedure, like surgery or other things, that they actually thankfully were allowed to come in to the hospital for us to still continue seeing them. And the other thing we also had to do was to attend to our foreign patients. We were getting a lot of panicked emails from patients that now couldn't come in and had to have their surgeries postponed or run out of medications, as Kimberly would have mentioned earlier. So we had to problem solve with them what we could do in the meantime, and also provide a lot of assurance. So it was certainly a very stressful time, and I kept worrying that I'd forgotten something important or that I'll lose track of patients in the midst of the mad rescheduling. And it was heartbreaking to hear about what was happening with our foreign patients and their difficulties. It made me realize how vulnerable we really are. What about you, Jia Xuan? What was your experience like?
Yeah, so similar to what you shared earlier, all of us had to scramble to find ways to ensure that patients and parents have sufficient support at home, right? So as for the patients whom I see, they are mainly children with developmental conditions such as autism and ADHD, as well as children and adolescents with mental health conditions, and even mummies with mental health conditions as well. So there's another group of patients whom I see, the premature babies for developmental surveillance. And this is the group of patients whom we really had to see face-to-face to monitor the progress of these children and also provide anticipatory guidance for parents. Rescheduling the outpatient appointments was indeed really stressful, like what you shared. And not knowing when we are allowed to see the patients again was really, really stressful. So parents have also started to provide feedback, give us feedback that they are not really coping at home, right? They have difficulty settling the child into the new routine with all the kids at home, and also struggling to find the right activities for the child to match the right energy level, right? So managing the behavior of the children has been very, very difficult. So with the kids being cooped up at home, they're unable to expand their energy with outdoor play. So all of them are kind of being kept at home. As for the adolescents whom we see, it was a very difficult period as they had to adjust to being at home 24/7 with their parents supervising them all the time. Not having the space for them to regulate their emotions and even the physical space away from the parents was difficult. Many of them ended up having urgent teleconsult sessions as they were not able to cope emotionally. As well as coming up with guidelines for teleconsults and ensuring that we're still able to see patients with more urgent needs. The other problem that we faced, or the other challenge that we faced, was choosing the suitable patients for teleconsult was very crucial. Teaching parents how to use Zoom for teleconsult, and as well as accessibility to a stable Wi-Fi for them to go online. Even the availability of a laptop or a computer was very important, as all the children had to go online for home-based learning. So choosing the right time for teleconsult was very, very important. It was indeed a very trying period at the beginning of circuit breaker, as we're all thrown into the unknown with so many uncertainties. But with working together as a team, we were able to come up with guidelines and resources very quickly, and to reach out to the patients who really needed the most. Many of the parents were receptive to try teleconsult as well, and we were all trying to make the most out of it during this stressful period.
Trying to make the most out of it is right. Being geographically small, Singaporeans never really had to rely on teleconsults. But with the new safe distancing measures, what we knew as our healthcare system got deconstructed so quickly, and we almost just had to, grab the few essentials and then just run with that. So now that we actually get some time to reflect, what do you think are some of the things that went well?
I think having a very adaptive and flexible team were open to try teleconsult helped greatly during this period. So coming up with resources and guidelines was quick, and it helped individual therapists to prepare for the teleconsult sessions. As what you can see from the picture, we had to use dolls, kind of like playing on our own and showing the parents how to sit the child up, how to engage in toys with both their hands, and even the other picture that you can see, teaching more the adolescents on how to manage the anger with the different zones of regulation. That was really important as well. And for the home environment, it was really good for us that we can see how parents can make use of the home furniture to create an obstacle course, or finding little corners in their house to create a self-care or a calm-down corner for the adolescents was indeed really helpful. Witnessing and seeing how the children melt down in their natural environment was helpful, and doing parent coaching on the spot to help regulate the child and to also facilitate the therapy process, which we were not able to do so in our clinic. We also showed resources via Zoom and also made use of YouTube videos. It was very convenient to share via the share screen function. As we got more and more confident with Zoom, parents were also more ready to accept teleconsults. We were able to run parenting workshops and even weight management groups with adolescents on a monthly basis after the circuit breaker. After the circuit breaker, we also shifted our mindset towards teleconsult, as some of the parents and adolescents do actually prefer teleconsults, as it helped to minimize the logistics required to come physically to the hospital. Parents were able to log in from their workplace, and the children were able to log in from home, and we were able to the same place. So what about you, Melody?
I think, like what you said also, definitely teleconsults were much more logistically helpful for the parents. One of the things that we did, because we realized very early on that the child is not going to perform in front of the camera, so we cannot assess any gross motor skills in that manner. They would just be very obsessed with whatever is happening on the screen and just going hello, hello, hello all the time. So what parents did was we asked them to take sneaky videos without their children realizing of what the child can actually do, so it's a more natural kind of way of assessing. We would watch these videos beforehand and then make little notes and run through these things with the parents. So things to work on, what are the next exercises to do and how to progress, things like that. I found that actually, and parents also found that the sessions then became more information packed. We were able to consolidate a lot of things and have a very clear plan moving forward. And if you see from the two pictures at the bottom, I actually could pull out the skeleton or pull out the IKEA man with the joints and start explaining to them, give them a small anatomy lecture, or start explaining things to them. And it was a lot easier to do this over the teleconsult way as well. The other sort of thing that we didn't think would happen, but it was a very happy surprise, was that we managed to get to know siblings a lot better, because the siblings being in their own home environment are a lot more outgoing, not as shy as they would be or as scared as they would be in the clinic environment, and very curious about what's happening on screen. So they'll come and they'll say hello as well, and then we'll get introduced, and we are able to see the children interact more in their own kind of natural family unit, and see the interaction between everyone, which was really nice. So now, apart from the things that went well, the other thing, of course, that we reflect on is what we could have done better. So one of the things we did try to do over teleconsult was to adjust equipment, which, these two pictures show how the parents would send me side views and front views of how the children were standing in their equipment at home. And then I'll send them back these drawings of, where all the joints should be aligned and how to do it. But this turned out to be quite tricky, because parents themselves were not so familiar with the equipment, not so familiar with, how to adjust things. And I really wished I could reach through the screen and just, it's just that screw.
Adjust it for them. Yeah.
Yeah, so this one was something that was really quite tricky to do. We tried once with a wheelchair adjustment, and that was really painful for both the parent and us and the child. I felt some other things that could be done better was that I wish that we had introduced the idea of teleconsults earlier. So what happened at the start was, because there was this mad scramble to reschedule, I think we almost gave parents the kind of lockdown mentality where we were just cancelling appointments, So they went into this whole okay, everything goes on standstill for a while. Rather than them still having continued care or continued access to us through the teleconsults. I did, feel that it would have been nice for us to have scheduled regular teleconsults, because this would have given parents some pit stops to reflect. We did see some deterioration in the children, especially with those with neuromuscular conditions who were progressive. Over, the circuit breaker, they didn't move as much, and they did come back to us a little bit worse than they were before. So I do wish that we had done these regular consults, so that we can keep on top of all this. And I think, of course, the mental health load as well, which I'm sure, you would have had a lot of experience with.
So for some of the patients with mental health conditions, on hindsight, I think they could have been reached out more intensively, even on a weekly basis, just for a quick chat, and even not for a full-on session, would have really, really helped them to cope better. Parents as well as patients themselves were not in tune to the mental health well-being, because everyone was just scrambling to get a new routine settled in, trying to learn, access Zoom or access the different various apps that the different schools are using. That was really, really difficult. So I think on the hindsight, we should have also discussed the emotional well-being of families as well as parents themselves being able to cope at home.
Yeah. So now that we know that teleconsults are definitely here to stay, they have their benefits, and moving forward, it doesn't seem like we'll be able to go back to all the regular face-to-face anytime so soon. So I do think that there's a lot to learn from a conference like this, even just hearing from colleagues or hearing from around the world as well. So I think we do have a lot to learn.
Yeah.
Okay, so thank you for your time.
Thanks for listening in. Thank you.
Thank you to all the speakers. I will now hand over to Dr. Tan Mei, who will present her last presentation. Mei, you're on mute, Mei.
Yes, okay. Is it better? Can you all see my slides?
Yep, you can.
Great. Okay.
Yeah.
Okay, hi.
And I need, thank you.
Great. Okay, hi everybody. My name is Mei. I'm one of the doctors in the Child Developmental Unit. So really glad to hear what everybody has been doing. So I'll be sharing some bits from our side. So just to share a little bit on what we do. So as we actually take care of all our children and families with developmental issues. So mostly we see patients with autism, ADHD or global developmental delay. Also together with the main hospital, we see patients with a lot of our new developmental conditions, patients with CP, also medically complex patients, extreme premature children. So we operate from 3 main places. So the main hospital, where we've heard from all our colleagues there. We also have 2 community centers to allow ease of access to our other community patients and families. And so you can see that the prevalence of all these conditions are quite high, and we do have quite a number of patients and families whom we support on a regular basis. So I guess today's purpose is really to share what is our experience and what was the main thing that we wanted to do throughout this whole process or COVID process was to continue to support our families and to have continuity of clinical care. So what are the challenges specific to the child developmental unit? I think, we are not different compared to the rest of our allied health who shared earlier, but we do know specific for us, time is sensitive, and early recognition of delay is important, because the earlier you recognize that there's a delay, make a diagnosis or share with parents what the problems are and start therapy, this has significant implications for the child as well as the family. And what was also a challenge, in this time was that it does rely on direct observations, direct interactions with the child, with the family. And same like a lot of our allied health was shared earlier, there's, the patient touch that's important to kind of get a better feel of what the child's needs and developments are. And again, as with in every aspect of pediatrics, the family is essential in overall management. So what were the challenges we faced? Virtual access was one of the things that we faced, because as we all moved and transited towards telehealth in this COVID era to maintain the social distancing, not all of our patients actually had virtual access. In line, those children or families with children with developmental disabilities, many of them actually come from less well-to-do and might not actually have access to a computer, to a laptop, or even to a phone to actually be able to conduct teleconsultations with us. And of course, some of the challenges that we had was basically a lot of the adaptations that we had to quickly do to continue to provide clinical care for our patients and the rapid change. And this was something that we had to deal with quickly. And of course, coordinating the teams. As you can see, we're a large team. We worked from 3 different centers, as well as with the main hospital. And this was some things that we had to deal with in the early beginning parts as we transited to continue to provide care for our patients. So at the same time, we had to maintain safety, and on top of that also as well staff well-being. As staff ourselves also have to deal with the pandemic measures.
May, you hung? Apologies for a slight technical hitch. I suspect Dr. Tan is trying to log out and log back in again. And we'll wait for her to unmute and then restart.
Okay, am I back?
Yes, you are. Thank you.
Not sure what went wrong, but essentially, so where was I talking about doctor visits and teleconsultations? So a lot of adaptations, like for the first visit, we still received referrals from other centers to deal with our patients, especially those who were recognized already to have during this COVID delay. Yeah, and then so they could be fast-tracked to see us earlier. And also for allied health and psychologist visits, we also conducted diagnosis and therapy, and so all our diagnostic observations were also conducted as much as we could over teleconsultations. What we also did was to check in with families. As shared, a lot of families actually were going through some difficult times, and it was a part of us. Some members of the team were actually had to check in with the families either through phone calls for those who had no virtual access, and we see if we checked if they had urgent behavioral or emotional issues, and then we had to fast track them for urgent help so that the families could cope. Of course, then the IT infrastructure was something that we had to get immediately, and we had a lot of support from our main hospital to get a lot of this done. So at the same time, being a tertiary center, research and education was something that we also tried to continue as much as we can. If this, a lot of the clinical research continued, and education, while we could not, a lot of our residents actually rotate through our departments, we still conducted teachings over Zoom to help them ensure that there's academic continuity as well. So we shared these adaptations, and these are online, so you can check them out there if you would like some details. Also by they shared their challenges, again similar to what were the difficulties that they had in terms of adjusting their occupational therapist sessions throughout Zoom. And then what was another thing that we thought that was important for us was to continue to support our families, not just through continuing clinical care, but also was the emotional and behavioral support. Specifically, we do know that we have unique difficulties faced by children with developmental needs. We know that sometimes it's not easy for them to understand all the rationale for changes around them, and as a group they have greater healthcare needs, medical needs, therapy needs, as well as community support. And we already know that their caregivers or their families at baseline already experience greater stress, and what more so now with the COVID-19 restrictions. Of course, on top of that, we have specific children, like for example, kids with autism. They have rigidity, they have lack of cognitive flexibility. Again, all this might lead to behavioral and emotional problems. And kids with ADHD who need physical movements, and this was sometimes difficult for them if they had to stay at home, and there was home-based learning, and they couldn't go to school anymore. And of course, again, there's a higher incidence of anxiety. So this was some sharing done by some of our parents when we conducted some online sharing with other parents in the community. As you can see, there are many, many challenging child behaviors that we see here. Kids with autism, kids with mild intellectual disability. There's some concerns are really adapting to these new routines. Many, many new triggers, a lot of crying, hitting, and sometimes also there's regression in their behaviors, and a lot of this affect the siblings, the parents, and the whole family in general. So this is one of the reflections by one of our nurses that I thought would be nice to share today. So our nurses, as part of our team, actually reached out to a lot of our families, those who are more vulnerable, those who have children, many children with developmental delays. So really, just seeing this part here, just taking the time to really listen and to offer a few words of comfort. And that's all we can do, and reach out. And even though we can't meet our patients in person, we can still care for them. So really reaching out matters. And I think this is what we can do as healthcare providers, is really to reach out and show them that we are trying to help them through this difficult period. So another thing that we had was on top, as part of our reaching out efforts, was really to send out resources to our parents. And this we also had shared, Laura has kindly shared with you all on the IAACD website. So if you can just go to the website, go to the Knowledge Hub, and at the COVID-19 Task Force, there's some resources there for families. So here, we can get them here locally as well on our NUH Kids website. And here are just some of the infographics that we share, helping children wear a mask. We get a lot of concerns on this because a lot are going to school. A lot of our kids are very sensory. They find it very uncomfortable to wear a mask or don't want to wear a mask. And a lot of our kids, with routines, adjusting to changes, how to help parents at home. So we found the general feedback that we have so far is that parents truly appreciate having these resources for them. So really the last bit is just moving forward our lessons learned. So as shared by all my colleagues before, this teleconsultation will continue. And I think with the adaptations and the changes that our team has made, so far this will work. Of course, we would need to supplement the face-to-face visit, given the nature of our work. And so far, as we are trying to progress and open a bit more, this has been shown to be quite helpful in helping us continue clinical care and service for our patients. And one important thing we learned was really the importance of really to advocate and reach out to our families with children with special needs and developmental disabilities, and more so for those underprivileged families. And really, I think the learning point that we had here as a team is really important to adapt and adjust as we go along. As mentioned, I think it's similar across to all of us working in NUH here, that as we encounter new problems, what to troubleshoot, what to do, and really at the core of it is to have our patients there. Yeah, so that's all from my side. Back to you, Laura.
Thank you, Mei. I'd like to thank the team for all the incredible hard work and rush that they had to put everything in together. And I feel that we've actually represented a good, we've had a good representation of our experiences within our establishment. Currently, there are just a couple of questions that have come up. One where Sharina has asked that they noticed over the COVID-19, particularly during the circuit breaker, children and youth with neuromuscular conditions like Duchenne's muscular dystrophy had lost appetite, and it led to weight loss. It also reduced activities, and during the lockdown, many lost their muscle function as well as motivation to regain social activities. Physiotherapy for such long-term patients should be regarded as essential services. And she also asked what the community could do to help the concerned individuals and families. I will let Charlotte, the dietitian, answer the part on nutrition, and Melody can answer the part on physiotherapy.
Hi, I'm Charlotte. So I think with patients who are experiencing some weight loss as a result of reduced exercise, I think the community would help maybe to give them constant reminders to actually eat their meals on time. I think also giving them choices of the food items that they prefer would be good. I think during the circuit breaker, it was difficult to get certain food choices because many outlets were maybe either closed or not operating. And if there were people who were able to prepare the foods that they preferred, that would be good. I think also coming together to alert their primary physician and getting referrals to the correct people would be helpful. I think for dietitians ourselves, we do more specific advice, and we would like to actually maybe offer them a teleconsult even if they couldn't come into hospital, to actually ask them about their dietary history and actually individualize the diet so that it actually suits their current situation or lifestyle. Melody?
Yeah, so for the physio aspect of things, hang on, Laura, can you off your sound? You must. Bring down the volume. Otherwise, sorry. So for the physio aspect of things, I think I mentioned in my presentation earlier that it definitely was something that we wish we had looked at earlier. So for community, I think a lot of the children that are under the special schools or the early intervention centers in Singapore, their school physios had actually given them home exercise programs. Unfortunately, a lot of the children or youth with Duchenne muscular dystrophy don't attend a special school. They attend mainstream schools. And that this is definitely a gap that we will have to make sure we try to cover the next time round. So a couple of things that come to mind would be, we have a neuromuscular clinic in the hospital. So if we could even just send out like a broadcast message to all the patients in that group to remind them about the regular exercises, simple things like tracking their step count for the day, or making sure that there's a certain duration that they are moving. And I think also definitely partnering with our community partners, the Muscular Dystrophy Association, to reach out to the patients that are under their care as well.
to make sure that there is some signposting going on to say that, you know, look, we touch base to make sure that there's a certain amount of physical activity, or just to make sure that everything at home is really going okay. Yeah, so this is, hopefully we don't have to go into another, you know, circuit breaker, but this is definitely something that we will need to look at a bit more closely lah.
The issue also that we had problems with this COVID-19, it was so rapid that physiotherapy was largely deemed non-essential. But we actually realized that actually a lot of patients with long-term medical conditions suffered from not being able to access regular therapies. So I'm hoping that in our country that we will hopefully be able to actually collate this information and bring it to the ministry, and actually should another lockdown happen again, that we would actually not just broadly cut everybody out of therapeutic interventions just because it's not acute. For the next question, by Laurie. Can you give some examples of guidelines you sent home? How would you adapt them for patients or families who were struggling? And if I can ask Joshua to answer that one.
Hi, yeah, so we kind of mainly use the handouts that we use for the outpatient clinic, and we address them during teleconsult sessions. We do use online resources as well, but we do send like parents some of the soft copies. So for example, the emotional regulation sort of handouts, we do tweak the strategies according to the patients and individualize it for them, because they're kind of cooped up at home, they've got limited resources. So that's how we kind of tailor it for individual patients.
Melody, could you add on to how you might have actually customized information given? Because guidelines are guidelines, but during this COVID-19, families coped very differently from family to family. How they managed with being at home, how they managed with how many siblings or children that they had to care for. And there were situations which were very tough, which Melody had experienced with some families. Where parents may not have been able to go home because of the nature of their work. Would you like to expand on that? That it was very difficult for parents to do therapy, to do exercises while caring for siblings when their support system disappeared overnight? I will mute.
So on my end, there was more of, actually I had the resources ready, but a lot of it was already available, you know, like the Can Child website, a lot of the resources for cerebral palsy or developmental delay that were already online. But what I found most useful was actually not sending it beforehand, especially if I don't know what the situation with the family is at the moment, but to share screen during the consult and then go through certain things. And especially for the families that were struggling because they had a parent who, you know, was seconded to somewhere where they were not allowed to come home and things like that. A lot of it was actually crossing out the non-essential exercises, paring it down to the minimal things that they needed to do so that the whole family as a whole doesn't have too much stress. So it was, I think, comforting for parents to hear, okay, I only need to do this amount of activity a day. I don't have to kill myself trying to do more. So yeah, and also, I found it a bit, if I sent the resources beforehand, they tend to read and then Google and think too much about it, rather than if I do it on the spot and go through with them on the spot, then I could catch a few more things.
Yeah. There was a question where Jasmine was asking during COVID-19, any changes in the way you assess autistic children? Now, I would like to ask Jocelyn, the speech therapist, for her input, because actually a lot of these kids are picky eaters, and I think that would have been challenging. And then Mei and Joshua, please chime in as you feel fit.
So I think for the children with autism who came to see us in the feeding clinic, we didn't really have to make many adaptations to
the way we actually assess them during the COVID-19 period. A lot of the times these children, we still offered them face-to-face consults for the children with autism who still presented with feeding issues, as we didn't feel that we will be able to get a good assessment if it were to be done over a teleconsult platform. So we still got them into clinic, and we were still able to do our assessments. Then we just had to be kind of still be cautious about the safe distancing measures, and making sure we wear our personal protection equipment during our face-to-face sessions. Yeah.
Can share. Then first, basically, as a medical review, basically the assessments, again, a lot of them, the first reviews, we would prefer to have them in the clinic face-to-face, because sometimes, especially if parents are not aware, sometimes when you want to speak to parents about the diagnosis of autism, it's really good to have a face-to-face interaction with parents for the medical review. But of course, having said that, our psychologists, once, we want to do the formal assessment, for example, if those of you are familiar, for the ADOS direct observation, we do ask them to come to the clinic to do this. But for the parent interview, this could be done over Zoom, just to find out a little bit more from the psychologist's point of view. So as much as we could, those that could be done through teleconsultation were done through teleconsultation. And of course, some things that were a bit more, like for example, if we had to tell the parents the confirmed diagnosis, things that needed a bit more, that it would be good to see the parents' reactions, and we felt would be better done in person. We still did this in person, but of course, with all the social distancing and the PPE in place.
Yeah, so as for OTs, I think for first visits, we still see them face-to-face. So no change in how we assess these children with autism. But if they're quite stable, we do provide teleconsults for parent coaching online. So not much of a change, but it's more of teaching the parents how to manage their behavior. But for initial assessments, we still see them face-to-face, of course, with the safe distancing and all these measures that we're taking.
Yeah, on that note, Jashan talked about parent coaching. We actually do have a tele health program here for parent coaching, which a lot of our parents actually found quite useful. Yeah, on top of all the benefits of teleconsultation, no travel, not taking time off, and some of them felt it was useful because you got to see the autistic child in their home setting, and so that was quite helpful for those who found it difficult. And every time they came to the clinic, they're not familiar with the surroundings. So some of those stable patients and undergoing therapy, all this could be done through virtual medium.
This will be the last question for our session, and this is a question from Ying-Chi, who asked us what aspects of care would be better delivered by telemedicine post-COVID. Our specialist nurse, Kimberly, has had to do a lot of communications with patients and things like this. I'll let her start off with how she found telemedicine was helpful or not, and then I'll just let everybody else chime in at the end, whatever they wish to speak, and then we will call the session to a close.
Hello. So I think that for the teleconsultations, it was very useful for our foreign patients, especially during the time that they cannot fly in. So we could actually do the consultations via Zoom, and then could get update, and then we could actually reassure them on how they could bring in the medicines, or how we could actually switch medicines that is available at their site. Yeah, so for those patients that, for example, our neuromuscular patients, it was also good for them, as they don't need to travel down to the hospital to have the consultation. Yeah.
Anybody else would like to round up? Or anything else to say? I'd like to thank all the speakers very much for all the hard work put into these presentations. And once again, I'd like to thank the IAACD for letting us be a part of your amazing 24-hour journey. Thank you very much. Thank you, Alicia.